Welcome back. Now, psoriasis is a non-contagious chronic inflammatory skin disease which results in itchy and flaky skin. And multiple studies worldwide have found that psoriasis leads to a significantly higher risk of heart disease and other health problems, well, such as diabetes and stroke.
The National Skin Centre says that between June 2012 and May last year, more than half of their psoriasis patients have been diagnosed with pre-existing diabetes, hypertension and hyperlipidemia. Here to share more on psoriasis and its related health risks, we're joined by Dr Eugene Tan, consultant dermatologist from the National Skin Centre. Welcome to the studio.
All right, so Dr. Tan, I have a question. What's the difference between psoriasis and eczema?
So both eczema and psoriasis are fairly similar, but one of the key differences is that eczema is much more common than psoriasis. Psoriasis affects about 1% of the local population, estimated to be above 50,000 people in Singapore have psoriasis.
So how do you tell the difference?
So typically, eczema may affect the skin folds, whereas psoriasis can affect any body site and tends to present as a very well-defined scaly red plaques and patches that can affect the scalp, any body site, such as the elbows and knees, umbilicus. So there are certain distinct distribution characteristics of psoriasis that can differ from eczema, and also the way it looks as well.
And psoriasis is a lot more serious than eczema as well, because it can do other things to you as well. Tell us about that.
Oh yes. So psoriasis is increasingly viewed as a systemic inflammatory disease, which means that it's not just inflammation in the skin per se, but there's also inflammation internally in the internal organs as well as in the blood vessels. So interestingly, there's a recent research which shows that psoriasis is actually linked to the metabolic syndrome. And patients with psoriasis have a 1.5 to 2 times higher risk of getting metabolic syndrome compared to people without psoriasis.
Okay, is it curable?
So unfortunately, there's no permanent cure for a lot of these chronic inflammatory diseases like psoriasis is included as well. But however, the good news is that there are many effective treatments that we can use to treat psoriasis to suppress the disease.
But that's just treatment basis. But can I do something to actually prevent me from having, psoriasis? Considering it's not contagious, right?
Yes. So we do not know of any way to prevent psoriasis because psoriasis may be genetically linked. However, there are certain triggers that may trigger the onset of psoriasis. For example, severe stress, having acute infections, things like that can actually trigger the onset of psoriasis.
And what's the biggest challenge to treating psoriasis?
I think psoriasis can be divided in terms of severity. So patients with very mild psoriasis can be easily treated with things like creams and lotions, whereas patients with moderate to severe psoriasis may sometimes be challenging to treat, and we have a range of treatment options for these patients.
And by treating patients, the psoriasis on the skin, does that also then sort of limit the damage that can be done internally?
So this is an area that's still under research. There's some early evidence that treating psoriasis effectively may reduce systemic inflammation, but this is still under research and we probably need more information.
Okay, so then the question then is, what happens if the person or the patient is unaware that he or she has psoriasis and then it just goes on untreated?
So I think it's very important for patients with undiagnosed skin rashes to actually see their family doctor or even see the dermatologist for opinion, because it's important to differentiate, to diagnose the rashes correctly, to get the correct diagnosis so that we know what are the implications and what the complications to look out for.
Is it quite common that happens, that people just dismiss it?
Yeah,
think
that
it's
maybe
like
a regular rash.
Or...
Yeah, I have a rash. I don't think very much about it. I just put like some topical cream and
actually,
I don't think about it.
I would suspect so, because I suspect that patients with very mild psoriasis may not even know that it's psoriasis or eczema for that matter, and they may just dismiss it or just apply some traditional creams, over-the-counter creams. But I would think that if the rash gets more severe, if it disturbs them, if it's itchy, then they would probably seek an opinion from a medical practitioner.
Okay, so then does this actually happen more in adults or children? Or it doesn't matter what age group you are?
Also, psoriasis is actually much more common in adults than children, unlike eczema, which is can be equally common in both children and adults.
Okay, well, thank you so much for coming and sharing your thoughts with us. Plenty to think about, and knowledge is the key to all these things. We've been speaking with Dr Eugene Tan, consultant dermatologist from the National Skin Centre.